I'm Brian Jacobs. I'm running the London Vegans meetings, which we have generally on the last Wednesday of every month, apart from December. And I just say welcome you all again. For tonight's meeting, it's my great pleasure to introduce Shireen Kassam, who is, I believe, the founder, is that right, of Plant-Based Health Professionals. She's going to talk more about that organization in today's meeting and what they've been doing. So without further ado, may I hand over to Shireen? Thank you.
Great, thanks very much, Brian. Really grateful to be invited to speak to your group that I know has been very active over a number of years, and I had the pleasure to come and talk to you back in 2019, but everything was very new to me then, and I'm not sure what sort of impression I made, but hopefully I'm able to show some progress of what we set out to do back in 2018. So thanks everyone for being here, and I hope that I'm going to be able to share some information that will perhaps support you guys in your advocacy and allow you to know what we've been doing as a health professional group to support the vegan and plant-based movement in general in the UK. So just a little bit about myself. I work as a consultant haematologist at King's College Hospital, and a few years back I became certified as a lifestyle medicine physician. So I do that 3 days a week. I also work 1 day a week at the University of Winchester, where I deliver an online course on the topic of plant-based nutrition. And as Brian says, I'm founder and director of a community interest company called Plant-Based Health Professionals UK, and I'll be talking about our work shortly. And I'll also mention Plant-Based Health Online, which is our latest venture. And I've been vegan since 2013. So I thought I'd give you just a bit of background, and I know you guys will know this all, but it's just a summary of why I am doing what I'm doing outside of my conventional NHS role. So as you're well aware, the food system is driving a number of our interrelated crises. It's a leading cause of our climate and biodiversity crisis, but it's also the leading cause of our health crisis. We're spending more and more time in ill health as we age, and many of these conditions are preventable. And you'll all agree with me that we have a crisis of ethics, whereby 80 billion land animals are killed every year and 2 trillion fish for food that you and I know we do not need. And when it comes to global diets, things are getting worse, really. And this report from 2021, the Global Nutrition Report that is published most years, if not every other year, stated that unhealthy diets are now responsible for about 1/4 of deaths globally. And in Europe and also in the US, around 1/3 of premature deaths can be associated back to an unhealthy diet. And at the same time, the food system in its entirety is creating over 1/3 of all greenhouse gas emissions. And when you consider what aspects of our current diet pattern are leading to chronic conditions and ultimately premature death, this question was asked by the Global Burden of Disease Study Group back in 2019, and it looked at dietary risk factors in 195 regions around the world, and basically saw the same results regardless of the country you were living in. So these data are relevant to the UK, and at that time 1 in 5 deaths were associated with an unhealthy diet, which meant that our diets were leading to more deaths than smoking and alcohol combined. And when you look at the individual risk factors that I stated in this table, the dietary risk factors that were causing ill health are diets high in sodium, which is a reflection of our reliance on pre-prepared and packaged foods, and particularly ultra-processed foods. And our diets are too low in the healthy whole plant foods, which I hope all of us are centering our diets on. And this was leading to excess deaths from cardiovascular disease, cancer, and type 2 diabetes. And just to remind you all that the UK diet really is particularly bad compared to many European diets, in that we are obtaining more than 50% of energy or calories from so-called ultra-processed food. So we have a great way to go to improve the healthiness of our UK diet. And as a consequence, albeit not the only reason why we're spending more and more time in ill health, but certainly unhealthy diets are a leading cause of our ill health. When you look at the health survey for England, for example, 42% of adults aged over 16 have at least one long-standing medical condition, and 16% of children have a long-standing medical condition. And when you look at the numbers or the percentage of preventable deaths and preventable conditions, 80% could be prevented if we paid attention to diet, but in addition, other healthy lifestyle behaviours such as regular physical activity, stress management, healthy relationships, avoiding toxins, and restorative good quality sleep, which are the 6 pillars of lifestyle medicine that I referred to at the start. And because of these accumulated sort of risk factors, we are spending more and more time in ill health. So although life expectancy is around the age of 80 in the UK, actually our healthy life expectancy is only around 68 years. So we're spending the last 12 years or so of our life in ill health, which is not something we want to be looking forward to. And this problem of chronic conditions was really exposed during the early part of the COVID-19 pandemic. On the left, you'll see a BBC article that was really referring to a UK-based study where 17 million GP records were analysed and showed that 90% or more of people who died in the first wave of the pandemic had at least one underlying health condition. And a similar type of analysis from the US published at the end of last year showed that out of 1 million hospital admissions for COVID-19, 60% were due to 4 underlying conditions: hypertension, heart failure, obesity, and type 2 diabetes, conditions which are eminently preventable if we approached disease prevention through a healthy diet and lifestyle approach. And then we had results out of the Zoe COVID app study, which I'm sure some of you may have contributed to, that looked at over 500,000 participants from the UK and the US and analysed the diet quality using the plant-based diet index. And what they were able to show was that a healthy diet centred around fruits, vegetables, whole grains, beans, nuts and seeds resulted in a 10% reduction in the risk of getting COVID-19, but also, and more importantly, reduced the severity of COVID-19 infection by 40%. So that's quite a dramatic association based on just diet alone. And this was accounting for confounding factors such as underlying health conditions and other healthy lifestyle behaviours. So when it comes to lifestyle medicine, which is a fast growing specialty globally that was born out of the American College of Lifestyle Medicine back in 2004, they make a statement on a healthy diet, and this is what it says. It says that the American College of Lifestyle Medicine recommends an eating plan based around a variety of minimally processed vegetables, fruits, whole grains, legumes, nuts and seeds. So what you and I and they, in fact, call a whole food plant-based diet. And here you can see the plate: half fruits and vegetables, a quarter whole grains, a quarter plant protein, mainly water for thirst, lots of herbs and spices, mainly for flavour, but also because of their anti-inflammatory and antioxidant properties. And this would be classified as a healthy plant-based diet, and whatever you do around the edges needs to be minimized. So for those people who aren't vegan, should be still centering their diet around these healthy foods and minimizing ultra-processed foods and animal-based foods, according to the American College of Lifestyle Medicine. And the reason being is that we have got decades of data now showing that this type of diet, alongside other healthy lifestyle behaviors such as regular physical activity, good quality sleep, avoiding toxins, really addresses the root cause of chronic conditions. And this diagram shows it the other way around, that unhealthy diet and lifestyle lead to adverse alterations in our gut microbiome, changes the expression of our genes unfavorably, so-called epigenetic changes, and causes cellular injury or stress, which ultimately lead to inflammation and then the host of chronic conditions that really are all related in terms of how they are brought about. And the good news is that we, again, have a lot of data to show that these lifestyle interventions, at whichever point you adopt them, can support the prevention, but not only that, the management and sometimes the reversal of these underlying root causes. So inflammation can be reversed. We can alter our gut microbiome within just a few days of changing our diet. Similarly, we can change the expression of our genes and reduce the stress to our cells. And so this information is broadly and widely known within the disease-specific guidelines that come out for us as health professionals. So I wanted to just show how embedded healthy plant-based diets really are in our clinical guidelines. So if you look at the primary prevention of cardiovascular disease from the American College of Cardiology, they recommend 2 eating patterns: plant-based or Mediterranean. And of course, we know the Mediterranean diet is healthy only because it contains a lot of whole plant foods, but of course they also consume fish and olive oil amongst the foods eaten within the Mediterranean diet pattern. But amongst plant-based, it's acknowledged in this guideline that vegetarian and vegans have improved health outcomes due to lower risk of ischemic heart disease. And this position statement, published early this year from a number of organizations, states that if you're trying to put your diabetes in remission, which should be the goal of anyone with type 2 diabetes, and for healthcare professionals treating people with type 2 diabetes, that the primary dietary intervention should be one that's centered around whole plant foods, whole grains, vegetables, legumes, fruits, nuts, and seeds. So a healthy vegan diet while minimizing or avoiding meat and ultra-processed foods. And this is taken directly from the paper. Similarly, for my specialty of cancer, the cancer prevention guidelines and after a diagnosis of cancer clearly states that eat a diet rich in whole grains, vegetables, fruits and beans. So there really isn't any sort of discrepancy here between, you know, what we are advocating as plant-based or vegan individuals and the disease-specific guidelines. And of course, there's no conflict between what is healthy for us as an individual and what's sustainable for the planet. So back in January 2019, the Eat Lancet Commission, who had brought together 37 scientists from 16 different countries, put together a dietary plan that would not only sustain our planet within planetary boundaries, but would also sustain health. And it was estimated that this type of healthy diet would save 11 million premature deaths globally every year. And if you look at what the recommendations are, half fruits and vegetables, almost a quarter whole grains, plant sources of protein is the biggest chunk of protein here in green. Unsaturated fatty acids, which come from plant sources, minimize added sugar, but there's a small strip allowed. Starchy vegetables, we can discuss the benefits of starchy vegetables at the end if you want, but given a small section there. And then animal foods really are minimized, and it clearly states in the document that it's not necessary for health. And if you are going to consume animal foods, that it should not be more than 1 portion of red meat a week, 2 portions of poultry and 3 eggs, and it's about 1 portion of fish. So really in line with a plant predominant diet, encouraging people to be as much plant as heavily plant-based as they can. And the UK guidance is similar. I'm not saying that it's been put into practice, but this is what you find on the government website, just published May 2022. This is really directed at healthcare professionals, urging us to apply a One Health approach to both individual and planetary health, and recommends a diet rich in plant foods and lower in animal source foods because it's better for our health and better for planetary health. And as health professionals, we've been called to action. This is what is written in the BMJ 2 years ago now. Without decisive and urgent action, the climate crisis will increasingly undermine human health and disrupt healthcare delivery. There are both moral and practical reasons for health professionals to be at the forefront of climate action. And for me, that also involves advocating for a change in the way we consider our diet and, of course, the wider food system as well. And again, medical literature talks about the ethics of what we recommend as physicians, and this paper published a couple of years ago also states that plant-based diets are a powerful tool, and not using or advocating for them is not only unethical but harms patients and the planet alike. So as I say, the medical literature and guidelines really do support a shift towards more of a plant-based diet and endorse 100% plant-based diet when it's adequately planned. So, bit of a long introduction. Why am I going on about this? Well, as I say, this sort of information is embedded within our healthcare guidelines, yet somehow we know that nutrition education is still not has not caught up with this really. It's only in October 2021 that we finally have an undergraduate curriculum for nutrition for medical doctors, which is a great step forward that we have a curriculum. What's slightly disappointing when you read the text is that vegan and vegetarian diets are only mentioned under the term restrictive diets and at risk of deficiencies, and it doesn't really mention sustainability, this document. However, when it comes to outcomes for graduates from the General Medical Council, it's expected that medical graduates should be able to counsel their patients about healthy diet and lifestyle, given that they are the key drivers of their patients' health outcomes and their risk of chronic conditions. And this publication, again from the Medical School Council, specifically addresses sustainable healthcare and what we need to embed within healthcare education to make sure that going forward the healthcare service is sustainable. And just to have a side note here, the NHS was the first healthcare system globally to declare a climate crisis, and it's committed to net zero emissions by 2045. And in my view, sustainable healthcare means that the healthcare that we don't need, it means emphasizing prevention rather than the usual sticking plaster approach of medicines and pharmaceuticals and surgeries, but it also means we need to address the food system, given that we all eat, and even within hospitals, healthcare institutions, public sector catering, we should be serving a sustainable diet. And it clearly pays attention to the impact of our food system on the planet in this document. And it talks about the harmful effects of the food system, and it talks about the benefits of a plant-based diet. So this is addressing healthcare education within medical schools in the UK. So on that backdrop, we founded our organisation, which is a community interest company, back in 2018, and we provide education and advocacy on whole food plant-based nutrition for the prevention and treatment of chronic disease, as well as for supporting planetary health, because there is this gap in the healthcare education that despite the guidelines saying that we should learn about nutrition and plant-based diets, it's not taught well at the moment. And so we kicked off by testing the water back in 2018 in March with a small group of fellow medical colleagues, and we had the first plant-based medical conference in the UK, which was a real success. It brought us all together and started our ability to network and learn together and hopefully change the education offering in the UK. And this is what we've hoped to do, and we've got a long way to go. We have been focusing lots on health professional education. We have membership that's open to everybody, but 2/3 of our members are healthcare professionals. And prior to the pandemic, we were obviously doing in-person conferences and events and having them CPD accredited, so people can use them for their appraisal portfolios and their evidence of lifelong learning. And more recently, obviously, with the pandemic, we're doing a lot more online education too. We love sharing education and resources with the public, who are clearly very interested in having credible evidence-based resources on plant-based diets. Some of our most well-used resources are our fact sheets, but we have articles and patient stories, we have cook-alongs, and we support events like VegFest and your organisation, and provide education and resources. And of course, we would love to influence policy, but that's an uphill struggle. But what we've done, and I'll talk about that a bit later, is really try to align ourselves with like-minded organisations so we can get involved with joint campaigns, respond to nutrition policy consultations, and sort of advocate together as a larger group, whether it be in the UK or the growing number of plant-based organisations around the world. And so just a few things that we've accomplished in these few years. So as I say, I was able to pitch the idea of a course to the University of Winchester back in 2018. And I've been running this online course. It'll be the 4th year now. It's fully CPD accredited, accessible online, virtually everywhere in the world. And it's endorsed by the British Society of Lifestyle Medicine. But it's also recommended to all GPs in England as part of the Green Impact for Health Toolkit, which is a toolkit for GP practices, of which there are over 700 practices signed up to this initiative to promote sustainable healthcare. So as part of that, it talks about supporting patients and staff to move to a plant-based diet. So it's been hugely popular, and I've just finished yet another running of it. And I'm finding as the years go on that non-vegans are taking the course, and I'm not just talking to the already converted. We've tried to provide and produce credible resources. So just this year in September, we've published a textbook called Plant-Based Nutrition in Clinical Practice. Pleasure of working with my sister Zara and our friend and colleague, registered dietitian Lisa Simon. It's a co-edited multi-author textbook covering all aspects of plant-based nutrition for use in clinical practice. We do CPD accredited webinars run by Rohini Bajekal, who you may know, who's our nutritionist, but also our communications lead, and that's free for everyone to join live. So do check them out and see if there are any topics you're interested in. The recordings are available just for our members, just so that they get some perks. And as I say, CPD accredited from the British Society of Lifestyle Medicine. I write a regular nutrition update, which you can find first on Medium and then on social media and subsequently on the website. So I write a weekly news review, so you're welcome to read that if you're interested. And then in the last year or so, Hayley Tate has come on board. She's a GP based in Liverpool. She is obviously vegan, and she's a chef and author. Do check out her books as well. She has come on board to run a module within medical schools. Now, it's worth saying that in medical school curriculum, 10% of the curriculum can be chosen by the student. So external organisations can offer what's called a student-selected unit or student-selected module. So we've created one with the funding from Veg Fund called Cooking for the Climate. So Hayley offers this practical sort of plant-based nutrition SSU, so student selected unit, at 3 universities this year. We were 2 universities last year, so Exeter and Southampton University, and this year King's College London are coming on board. So that's really great that to be able to get medical students exposed to this, and she's had great feedback. Myself and my colleague LJ Smith have been touring different hospitals around the country this year. You can see where we've spoken. And this has been one of the good points of the pandemic, in that grand round. So every hospital has a grand round meeting every week, which is an educational meeting for all of the medical staff. And since the pandemic, it's all come online. And so we've had the opportunity to offer a talk to various hospitals, and we'll continue to do that. And just to show you, we don't shy away from talking about the ethics and the issues associated with our current farming system. And it's generally been received well with a lot of interested people. We've been trying to get out peer-reviewed publications, so you'll see that we've published in the British Journal of General Practice. We've published some case reports, like from our patient advocate, Kate Dunbar, who's part of the team, and we wrote up her case series. We've just done one on migraine, an article on nutrition education, and we need to build up higher quality publications, but it's a start. And then, as I say, one of our most popular resources, which I hope you might find useful as well, is our fact sheets. They're free to download on the website. And we've got dozens now on various topics. And we respond to member and non-member requests for fact sheets on conditions that they would find it useful to have either for themselves or for use in their GP or clinical practice. So do have a look and let us know if there's anything that's missing from our array of fact sheets. And then I've personally been able to use my workplace as an opportunity to advocate. Again, it's been a little bit easier in the last couple of years as healthcare organisations have been looking to reduce carbon emissions, and often food is forgotten, but we're very lucky that we've got a forward-thinking CFO who's our sustainability lead. In fact, he's married to the CEO of Wagamama's and has a vegan daughter, so understands the issues related to the food system and the need to move towards a plant-based food system. So last 2 years we've been running our campaigns for Veganuary and No Meat May, and have managed to get a good numbers of staff engaged. This is just before the pandemic, and since then we've been running WhatsApp group and Facebook groups, and just making plans for Veganuary this year as well. And as a consequence of our advocacy at the hospital, within our King's strategy and within the Green Plan, we have managed to at least get a sentence or two on food. And the King's strategy includes moving towards a healthier, more plant-based menu that will progressively remove processed red meat. It's still work in progress, but at least the intention is there. And Hayley Tate, who I mentioned, who you'll see in this picture here, she also runs a community kitchen in Liverpool. It's called Vinnie's Kitchen, and we sponsor that with our funding. She runs classes for school children, community groups, underserved areas, and all the food gets packaged up and delivered to the homeless communities in Liverpool. So that's been going for over a year. And then it was January 2021. Gosh. No, I think it was January 2021 that we launched a healthcare service to go on to be a companion to our education service. So this is Laura Freeman, who's a GP based in Scotland, but also a lifestyle medicine physician, and needless to say, an advocate of veganism and plant-based nutrition. And we launched an online healthcare service where you can book an appointment to see her as a GP or a dietitian, or join a group program for improving your health for people who are looking to shift their diet, improve their diet, avoid medication, or just improve their health status. So it is the first CQC registered plant-based lifestyle medicine service, fully online, so accessible from wherever you are. And of course, I'm not an advocate of private healthcare, but to get it off the ground, it has to be a fee for service at the moment. And as hopefully we accumulate patients and positive data, we can use that to try and access NHS fundings for our lifestyle medicine service. We have a 21-day plant-based health challenge. So this is an email-based sign up, where once you've signed up, you get 21 days of emails with videos and information, recipes. And I think we found that GPs have reported back that it's a really useful thing to be able to support their patients with. So, obviously we don't have much time in the clinic space, but being able to give people something to sign up for with regular information and resources over 21 days was the aim, to be able to make sort of a healthy diet more accessible for individuals and in the clinic room. And then we work with Eden Green PR, and Rahini Bajekala, comms lead, it works with them very closely. And I hope you've been noticing over the last couple of years that we are managing to get into more high tier publications. And hopefully getting known to be able to comment on issues related to diet, nutrition and health. Our members, including myself, have written a number of books over the last 2 years, so hopefully there's an array of UK-based authors, health professionals who have contributed to the general literature on the topic. And I just wanted to point out that obviously there is international momentum here. This is in New York. The Grossman School of Medicine now has a culinary medicine course for medical students, which is fully plant-based. You may have heard about the first mandatory plant-based nutrition curriculum at Wayne State University. We were all championing Eric Adams, the vegan mayor of New York. He has got a number of plant-based initiatives. He's rolling out plant-based lifestyle medicine services, headed by Michelle McMacken, a friend and colleague based in the US. But importantly, he's also transitioned hospitals over to making plant-based menus the default option, and meat is the sort of special option if people ask for it. So that's a great step forward, and it's a great example to be able to use to our hospitals here in the UK, which have a great way to go to make such healthy and sustainable changes. As I've said, influencing policy, a bit more difficult, but what we've been trying to do is join groups that are also advocating for policy change, responding to consultations. We're part of the Food and Health APPG group, and we've had a chance to present there as well back in 2019. And, using current issues like the pandemic to our advantage and the climate crisis, of course. So we're a member of the UK Health Alliance on Climate Change, and the other members are all the kind of royal societies and colleges of physicians and pathologists and all sorts of people. And we've been able to contribute. So, for example, we're doing a lunchtime teaching session on sustainable diets coming up in December, and this should be attended by members of the medical community. And just to remind you that we really, at the core, we are vegan advocates and try and do our bit to support all of you guys who are out there doing the grassroots work to change the way we consider animals. And we are trying to write about this in the medical literature as well. So again, this is in the British Journal of GP. Laura and I wrote an article, healthcare professionals need to demand a plant-based food system for all the reasons we know. And I think, times are changing. The British Journal of GP is happy to publish articles like this. So I think, there is an audience of people who are willing to listen and hopefully make changes too. So, of course, none of this work is possible without the fantastic members of my team and our wider membership. And I know some of the members are in the audience, so I thank you for supporting us. Our membership is open to everybody from general public to health professionals. We've kept it as affordable as possible. It just helps us with a general bit of funding. And we've got quite a lot of member perks now with journal clubs and book clubs and all the webinars. And now we're opening up back into in-person events. We've had a couple of socials. So, do consider joining or just supporting us if you're able, but otherwise most of our resources are free anyway. And there's many people, including my wonderful family, who support all the time. I'm lucky to have a family who have all shifted to a vegan and plant-based diet and lifestyle. And of course, we work with wonderful people and their organisations that are listed here. And our main funders are the Karuna Foundation at the moment. And I'm sure you guys know all of these wonderful businesses. Eden Green PR, Vegan Accountants, Mad Ideas do our website, and some other funding bodies that we've been lucky enough to get grants from. And of course, my daily reminder of why this is so important. So Pansy and Belle, who are take all our attention when it's not given to our work. So thank you very much.
Thank you, Shireen. Thank you for very, I'm just spotlight myself. Thank you very, very, a whistle, what's it called? I can't remember what the word is. Doctor. You've packed in an awful lot over the last 2 or 3 years. It's quite amazing, really. I'm sure that some of our members and some attendees have got some questions. So if you have, could you raise your hand, ideally in the system here? And if you're happy to be on the video, I think you may come up on the video if I spotlight you. Yeah, John, are you okay to be on the video? Yeah. Okay. Let me just.
Yeah.
Hi, John. What do you want to ask?
Right. Yes. Yes. Thank you very much for an excellent talk. You mentioned epigenetics, get epigenetic changes. I don't know a lot about that, but would it be the case that, say, a pregnant woman, if they've had a poor diet and they've had some epigenetic changes, and the husband as well, but during the pregnancy, might that get passed on to their newborn child?
Yeah, absolutely. It's a really interesting question. And just to clarify, so epigenetics refers to how your genes are expressed. You know, we're 99% all the same, essentially, but the way our genes are expressed clearly differ. And those changes to the expression of the genes is given that umbrella term of epigenetics. And the answer to your question is yes. In fact, the studies have looked back generations, so the diet of our grandparents and the lifestyle of our grandparents can change the expression of the genes that are passed down to us, if that makes sense. So yes, absolutely, gene expression, when altered by lifestyle, is then passed on to the next generation or several generations down the line. But that's not to say that you can't then positively impact your individual gene expression by adopting healthy lifestyle behaviours. And that's been shown by many people, but including the work of pioneers like Dr. Dean Ornish, who's shown that within a 3-month period you can alter gene expression.
Good question. Thank you. I've got Mahersh. Are you okay to do the video, Mahersh?
Yeah, that's fine. Thanks very much. Shireen, thanks very much. Great talk. I came in a bit late, so I missed the beginning, but always lovely to hear you and brilliant work that you all do at Plant-Based Health Professionals. I just wanted to ask you, historically, I've, in the medical field, medical professionals, the general view I perceived was that a plant-based diet, vegan diet, is perhaps, it's quite negative generally, historically. I was just wondering, now that you're at the forefront, you're a medical professional yourself, how are and you're trying to, educate your fellow medical professionals about all this. How is it perceived from your perspective? And have things changed? Have things moved on now in the way people are thinking about this?
Yeah, great question. And thanks, Mahesh, because I know you support our work as well, which we're really grateful for. So yeah, I mean, I feel like in the kind of almost decade that I've been vegan, that it feels like the conversations I have now with other health professionals is different. Whether it's because I seek out those that align with my ethics and the way I choose to live, I don't know. But, I didn't think it was going to be possible to be running Veganuary and No Meat May at my hospital and to have that endorsed by the executive. That's a major change. And I know it takes just a few like-minded individuals, and you have to be fortunate enough to for your paths to cross. But I'm not a unique example of a workplace or a hospital that's promoting Veganuary. I know that Rosie Martin, our dietitian, she's able to do that at Exeter Hospital, and I'm sure many of you have seen around the country that it's not unusual to see Veganuary signs up. And then I think it varies amongst my immediate peer group. I think more and more people are aware of the concept of plant-based diets, about wanting to move or needing to move to more of a plant-based diet for all the reasons I mentioned up front and that we're well aware of. I think there's still some antagonism to the word vegan, and I certainly tend not to use that so much in the workplace. I don't talk to my patients about becoming vegan because that's not necessarily appropriate. But I think I think there still is a bit of antagonism, and people are happier to talk about more plant-based diets and rather than the whole ethos of, and it's difficult, isn't it? In a healthcare system that is so far away from adopting the vegan ethic, the fact that all our medicines are tested on animals, so much of what we use has involved animals somewhere along the way. So, we've got a lot of work to do to create a kinder, more compassionate healthcare system, despite having the ability to and having the techniques and technologies to be able to move away from animal models and things like that. So I don't know if that answered your question, but I think things are changing, but it's not fast enough for us, is it? I mean,
Yeah, I think there is change, as you say. Just two observations I've made recently. One of the Queen Square hospitals, in their cafe, there was a sign outside the hospital saying, we are aiming for 50% plant-based. So that must have the support of the medical staff at the hospital. So that's one thing. And I noticed also one of the medications that my mother takes was Vegan Society approved, proper prescribed medication. So it had the vegan logo on it. So things are slowly starting to like that.
Well, that's really great to hear. Yeah.
Great question. Thanks, Mahersh. I've got Paul Appleby. Are you okay to be on the video, Paul?
Yeah, fine.
Okay. I mean, that's not. Okay.
Oh, hello. Hi, Shireen. What a whirlwind talk! I couldn't keep up with it. Well, question I have is: does plant-based health professionals provide a sort of consultancy service to the vegetarian vegan movement generally? I'm thinking of organisations like the Vegan Society or Viva or the Vegetarian Society. I think they will, some of them have dietitians, nutritionists as employees, but perhaps not all of them, and perhaps not as well qualified to comment on articles, news in the media as PVHP can.
Yeah, thanks, Paul. And as you probably know, or hope you know, that we both sit on the Vegan Society Research Advisory Committee. And so the Vegan Society certainly know about our work, and I've certainly, have conversations and dialogues and joint statements with, it was Heather, wasn't it, the dietitian? I think she's moved on, but Chantel now. So yeah, certainly in touch, and say I'm a member of, and they know about our work and they connect with us. I'm not so much in touch with the Vegetarian Society, but certainly Viva, definitely we've done a few things together, and Peter and things. So often when there's a joint statement or signatures or whatever, or fact checking to do, they do connect with us. So I'm hoping that people are reaching out to us, but that's partly the reason why it's useful to talk to people like yourselves, and that hopefully you can spread the message that we do exist, and come and use our personal resources, whether that's us as individuals or our online resources.
Thank you.
Okay, let me remove that. Let me ask you a question. I know John's got another one coming up. Is there a percentage of whole food plant-based? In other words, in terms of a vegan diet, is there if you're not going 100%, is there an optimal percentage for whole food?
Yeah, in terms of where you will sort of harness the health benefits, but still allow yourself to have some animals in your diet. Well, I mean, I always
not animals in the diet, in terms of in other words, at one end of a vegan diet is 100% junk food, and at the other end is the whole food plant-based. I'm wondering, for the vegans, is there a percentage that point that we're going to get benefit, and is it detrimental having a few chips and a burger here and there, or
No, I mean, I think we have to live within the society that we find ourselves, and within the societal norms. And I think none of us say you shouldn't eat any vegan ultra processed foods, but I think you do need to limit it. And for me, I mean, this isn't necessarily science based, but I think you should limit it to sort of 10 to 15% of your energy intake, and making at least 85 to 90% whole plant foods. But and I think everyone will be slightly different in terms of their threshold where they notice that health benefits are either gained or lost. And of course, if you are lucky enough to sort of be transitioning to a plant-based diet because you have a health condition that you want to reverse, then you have to be particularly strict, because your intervention needs to be really quite strict in order to harness all those benefits for disease reversal. But I think for the regular person who's not suffering from health underlying health conditions, I think 85 to 90% is fine, and allowing yourself to 10 to 15%.
Okay. Right, thank you for that. We'll go back to John. And
yes, you're a hematologist, which I think is about blood. I go blood donating every 3 or 4 months, and they always take a little bit of blood first to check your iron levels. And they always say mine goes down very quickly, meaning I've got lots of iron in my blood. And I've always asked them, and they usually say that some vegans have got more than average amount of iron, but others have less. Have you got anything you could add to that about, because people often say iron is something is a bit of a problem for some vegans, and somebody suggested that the longer you've been vegan, the better you are at absorbing the iron from the plants. But what would you say about vegan diet and iron intake?
Yeah, no, good question. And clearly you as a man are at an advantage. There's no mechanism for the body to lose iron other than blood loss, so you're obviously donating blood, but for women, clearly with menstruation, there's that additional loss of iron on a monthly basis prior to the menopause. So iron deficiency is one of the commonest deficiencies globally. It's not a vegan problem. My understanding of the data is that you're not more likely to be iron deficient, but your ferritin, so the stores will be lower, and your body is able to adjust to its requirements better when it's dealing with absorbing plant-based sources of iron rather than animal sources in the form of heme iron, which is more readily what's called bioavailable or more readily absorbed. So I don't think it's a particular vegan issue. I think it's an issue with the fact that women have commonly issues around iron deficiency, and children are at risk just because they may not eating a varied enough diet. So I mean, I think it is a nutrient that we need to focus on as vegans, but same with all diet patterns, really. I don't know the answer to the question about whether you get better as you the longer you've been vegan. I think just plant sources of iron, your body can adapt to your requirements better and not absorb as much if you are replete, but absorb more if you require it. And then obviously you'll know that you can enhance the bioavailability by adding a source of acid to your iron rich food, and avoiding tannins and tea and things like that when you're consuming your iron rich foods.
Does that answer the question, John?
Yeah, very much. Yep.
Thank you.
Indeed.
We've got Paul Campbell. Are you okay to be on the video, Paul?
Yeah, I am. Yeah.
Okay. Let me fire ahead with the question.
Yeah. Hello from Galway City on the west coast of Ireland. The question I have for you is that some people sometimes suggest about the book, how to eat right for your blood type, and it indicates, if you're, is it blood group A, you could be more vegetarian, or blood group O, you should be more non-vegetarian. Like, I don't agree with it at all. I'm just wondering, because it was mentioned you're a hematologist. I just would like your thoughts on it and how you would counteract if somebody said that to you.
Thank you.
Yeah, thanks. Good question. I don't think my haematology training has helped me answer that question, to be honest, because as you might imagine, that's not on any of our board exams or anything. I mean, you know, the simple answer is that it is nonsense in my view. And actually, PCRM, as Neil Barnard's group, did a study and not so long ago that really showed that the sort of hypothesis really was flawed, and actually there is no blood type that means that you're not going to benefit from fruits, vegetables, whole grains and beans, essentially. So I haven't found any convincing data for that. I think you can hypothesize about lots of things. It's like saying, you know, lectins are bad in beans, but actually beans are associated with great health outcomes. And I think that's what you need to look at the end of the day, isn't it? What the health outcomes are associated with consuming certain foods. And for all blood type groups, it's clear that eating more plant-derived foods is beneficial for disease prevention and longevity.
Thank you.
You mentioned in the talk about starchy foods, and maybe the controversy is about potatoes, and Dr. McDougall. I just wondered what your thoughts are on that, because you said we could have a quick word.
Yeah, no, absolutely. And I think that's one of the things about that the planetary health plate that is a little disappointing, how small the section is on starchy vegetables. And it's in part because, or mostly in my view, because the whole project was led by Walter Willett, who heads up the Harvard School of Public Health, and they've been running 2 large cohort studies for decades, so the Nurses Health Study and the Health Professionals Follow-Up Study. And maybe some of you will have other opinions, but my view is that, you know, that those studies showed that in general, people eating more potatoes, and generally white potatoes, had increased risk of carrying more weight, hypertension and type 2 diabetes. That was regardless of the cooking method. Now, I guess those analyses are always done on the background of a kind of standard omnivorous or a standard American diet. It doesn't, their cohort isn't vegan or vegetarian, so it doesn't really tell us the impact of consuming starchy vegetables in a plant-based diet. And obviously there's a lot of great evidence that, you know, consuming starchy vegetables as part of a varied diet is absolutely fine. So I have no problem with starchy vegetables. I think you have to do what works well for you. I think the key really to a healthy plant-based diet has to be variety, and that's perhaps where a lot of people, including myself, perhaps fall down, because it's easy to reach for the same types of vegetables and fruits every day, every meal, and just, you know, have a handful of dishes that you cook. So I think as part of a varied and diverse plant-based diet, I don't have any problem with starchy vegetables. And not every cohort study has shown those same results as the Harvard studies. And as I say, it's not in a group of vegetarians and vegans. So I've not seen any adverse data suggesting that people on a vegan vegetarian diet who eat more starchy vegetables have worse outcome. But maybe Paul has something to add there, because I know he knows the EPIC Oxford study very well, but I've not seen any adverse outcomes from that in the context of a plant-based diet.
Anything to add? Paul Appleby, that will be.
Yeah.
Maybe not.
Yeah, well, no, I'd say is that potatoes are generally not considered to be part of your 5-a-day fruits and vegetables, for, I think, for the reasons that Shireen's outlined, that they don't seem to convey the same health benefits. That said, personally, I don't think there's anything wrong with potatoes in moderation, especially if they're not fried in tons of fat.
Yeah, there's a bit of a difference between boiling a potato in its skin and eating the skin, and having cutting the skin off and making chips. So yeah.
And I guess it's worth just commenting that, you know, in Okinawa and the blue zones, you know, their reliance on purple potatoes. So, you know, I think it needs to be context specific, but yeah, we shouldn't be just only focusing on the white potato. And I'm
assuming they also eat tremendous amounts of rice. So yeah. Because I know John's already spoken. Isabel Bork, would you be okay to be on the video, Isabel?
Yeah, that's perfect.
Thank you. Let me just add. Thank you. Yes.
Hiya. I'm a fourth year medical student in Cork in Ireland, and I'm also a member of the Vegan Society in Cork in UCC. And I just found that we have received on the Vegan Society, when advocating more recently with plant-based universities, I don't know if you've come across that movement, that we've had a notable amount of backlash from people accusing us of being like triggering or like thoughtless of people in eating disorder recovery, or struggling with restrictive eating habits. I was just wondering how you respond to that kind of reaction.
Yeah, I think that's a really tricky question and a really tricky topic to address, and I'm sure much better answered by a dietitian or nutritionist. In fact, we had a webinar just a couple of weeks ago on eating disorders and plant-based diets, given their sort of association for a variety of reasons. It's a discussion in itself, but I think it just requires sort of open conversations and trying to be as inclusive as possible. I mean, clearly there are people who have extremely restrictive eating disorders. They're going to be few and far between, and it's understanding how to best meet their requirements in an overall system that needs to shift to more plant-based eating. I'm afraid I'm not sure that I really have the answers to that, but I think we do need to be aware of, you know, the condition which people are terming ARFID, aren't they? You know, the very restrictive diets. I mean, it's relatively rare, but I think you need to include them in the conversation and make a way of supporting them with their issues in the same way we try and be, you know, inclusive of so many different aspects of the way people have to live. So yeah, I think we need to be aware, and probably to be getting a like-minded dietitian or nutritionist involved to answer that, because I don't think you or I in the medical field can really possibly address this minefield.
Thank you. Thank you for the question. We've got about 3 or 4 minutes left. And I've got John. If anybody else has a question in that last few moments, please raise your hands now. And I'm going to go back to, I've got Hoi Lala, yes. If you could unmute, will you be okay to be on the video?
Yeah, that's fine, Brian.
Okay. Yeah, fire ahead.
So Shireen, thank you for an amazing talk, and I'm completely in awe of how you juggle that, your sideline with your day job. Amazing. So my question is, do you see any real benefit from a purely health perspective of organic?
Good question.
Yeah, that's interesting. And it's not something that can be answered in its entirety. You know, obviously it makes sense that we should minimize exposure to pesticides and herbicides and various environmental toxins. You know, clearly we know that a lot of these environmental toxins concentrate higher up the food chain, so we're already doing a bit better in terms of choosing to eat plants. When a lot of the worry centers around cancer, and from what I'm aware, there's been 2 studies reporting benefits from eating more organic foods for reducing the risk of cancer. So there's the Million Women study from the UK, and there's the Nutrinet Santé study from France. That wasn't in a vegan cohort though, it was just generally people reporting that they were eating organic food versus non-organic, and it was in cancer types where it makes sense. So for example, lymphoma is one of the cancers, the one that I treat, for example, that is supposed to be associated with exposure to certain pesticides and herbicides and things like glyphosate and malathion and things, which is why the WHO has classified these compounds as a group 2A carcinogen, so probable. But having said that, I think in the ideal situation, to answer your question, yes, it would be great to say everyone should eat organic food, but there's problems with organic farming, and it's not necessarily a sustainable way of farming if they're still using tillage-based methods of farming, and it's currently not accessible to everyone. And we would do much better on a population level if we just shifted away from animal foods and ultra processed foods and more towards whatever plant foods you can access. So yes, there is some data, but it's not strong enough for me certainly, to advocate as a health professional to say, you know, if you've got cancer, you must only eat organic food, sort of thing. Or if, you know, I think the evidence still supports eating more plant foods, regardless of the kind of methods of farming.
Okay, thank you. Thank you for the question. Final question, I'll go back to John.
Yes, thank you. Yes, I know that certainly up until recently anyway, medical students in their 5 years do something like 5 hours, something like that, on nutrition in their 5-year training. Would your group, would you think it would be advantageous if you started trying to push the authorities to give more time for doctors to study nutrition during their training?
Yeah, no, absolutely. And maybe the medical students in the audience can comment. I mean, that work has been done for me already. I mean, there's plenty of students who have been advocating for more nutrition education, and the main group in the UK is called NutriTank. And that's where this nutrition curriculum has come from. So, I mean, it's been years of advocacy from the medical students. And finally, October 2021, we have a curriculum, which means that medical students medical schools need to incorporate this. But as you might imagine, it's one thing having a document, it's another thing jamming more things into an already packed curriculum. And so how medical schools are going to do that, I don't know. We need to wait and see whether they're going to do it in the way that we've been trying to get into medical schools through the student selected units, or whether they're going to try and incorporate it into sort of clinical placements, whether there's going to be interprofessional learning with dietitians and nutritionists. I don't know. There's always a big gap in time between sort of recommendations and implementation. The problem I think we face, so I don't think there's a problem in people recognizing the importance of it. There's a problem in a crammed curriculum, but also what is considered the optimal diet seems to vary based on the teachers and the educators you have in that site. So as I say, the curriculum doesn't even refer to sustainable plant-based anything. It's vegetarian and vegan. They're given 2 lines under the section of restrictive diets. So this is not going to be the solution to our problem of educating doctors to know more about plant-based diets.
Right. Yeah.
Thanks ever so much, Shireen. I'm just going to ask everybody if they could unmute. I'd just like to say thank you. I mean, it's been very informative. For those watching, if you want to watch again, hopefully we're going to have this video up on the Plant-Based Health Professionals YouTube channel, so you'll be able to watch again, and then the links will be going out on the meetup group to Shireen's website, and they should also, I think, have been in the email, those on our email list. So if you would like to give Shireen a wonderful round of applause, I'd appreciate it. Thank you.